We got an appointment for October, and October 1st is when my benefits kicked in. And I remember thinking, you can't die until October 1st because that's when your benefits kick in, and that's when your family's going to be okay.
Yeah.
And then October 29th, y'all put some orthotics in my mouth, and I woke up the next day and I was okay. It was then Saturday, and I was like, okay, now we're going to do this, we're going to do this, we're going to do this, we're going to do this. And he was like, oh, crap, she's back. Like, oh, man, we got to go do all this stuff again.
Hi, I am Dr. Daron Clark, and welcome to the Integrative TMD Solutions podcast. After years of working with TMD and headache patients, one thing has become clear is that so many people are searching for real answers and lasting relief, but they don't know where to turn. That's why I started this podcast, because we want to share what we've learned, we want to bring insight, and most importantly, we want to highlight real patient stories. And today, I'm sitting down to speak with Michelle and to talk about her experience and what it was like before treatment, what changed, and what life looks like now. And I think you'll really enjoy hearing her story. So, Michelle, thank you very much for coming in today.
We're glad to be here.
We're happy you're here. If you will, just kind of start with the history of this, right? When did you start dealing with these symptoms? When did you start noticing this pain, and how was it affecting your life?
I thought about that the other day, and I can go back and remember having a really bad neck pain, probably when I was in my 20s. And so I would do a lot of different therapies and stretches and massage. And as I progressed and got older, about, I'd say 12 years ago, I was, working at a computer every day, driving to work, and, just really bad cramps in the back of my neck. And I was driving into work and everything just blacked over. And I was on the highway and I got really scared.
Yeah.
And then I could see again, and I drove and I called you and I told him what happened. And he's like, okay, we need to go see a neurologist. So we got an appointment and we get all the scans and everything. And they're like, you're great. And it's like, great, we're great. Okay, good. And then, just like, well, I guess I just need to stretch more. I need to do all the things that you're supposed to do and I'll be okay. And I would have these little, symptoms, episodes like that. And then last year, I started having really bad ringing in my ear. And I was like, okay, I'm going to go figure out what this ringing is. I'm sure I just have some type of infection, maybe from swimming in a lake. And again, it was like, nope, it looks great in there. I went to the ENT at Vanderbilt, and they did every single test that you can imagine. And every single test is like, no, everything is great. The last test we're going to do is an MRI. I said, okay. And during this whole series of trying to figure things out, I got vertigo one day. And I was just in bed and the whole room is just absolutely spinning. And
that's brutal.
Yeah.
Yeah, it's really tough.
And we went to the doctors and, he's just like, well, maybe it's crystals, maybe it's this. But by that point it already had subsided. So it's like, well, it's, just keep going on. And then on December 1st of 2023, we went to the East Nashville Winter Festival, and we were walking in, and I was just like, I do not feel okay. And so we saw some friends, and we started talking to them, and I just started tapping his arm, just like, and thank God he was right next to me, and I passed out, actually passed out, and he thought like, well, maybe if I hold her for a little bit, she'll just come back around and, you know, we can recover from this. And then he was like, oh no, she's down. So he lowered me gently to the ground, and you didn't know what was going. I mean, you guys didn't know. Was I okay? And we had our kid with us.
It's frightening.
It was horrible. And,
Yeah. Yeah. It was one of the worst experiences of my life, for sure. I thought my wife had died. I thought she died. That's what it was. I mean,
That's
she
terrible.
was on the ground with her head in my lap. It was just totally,
Yeah.
And I remember thinking, oh God, this feels so good. Oh, this is so great. And I just like kind of went away. And then I was like, oh my God, I am on the ground in East Nashville at the Winter Carnival in front of my kid's teacher. You know, I was like, come on back.
Right.
Yeah, I mean, there was probably 100 people around us that
horrible.
we knew from where our kid had gone to elementary school.
Mm-hmm.
So I just remember people looking down at me. It was just like,
It's horrible. And so we just got a lift and we went home. And a couple days later, the ENT called and said, hey, you've had a stroke. You probably need to go to the emergency room. It's happened sometime in the past, over a month ago. We don't know exactly when it was, but why don't you go in and we'll start to do some tests. So we went in there and, you know, just did the whole 9 yards, looked at the heart, looked at the head, and got a neurologist. And, you know, I had a stroke and I didn't have any atrophy, right? I had all of my functionality. So I was not very, she wasn't very interested in me.
Okay.
You know, because it's like she's interested in the people that she needs to go save.
Sure.
And so when we went and we talked to her, she's just like, 30% of the people that have that type of stroke, they die. 30% have some type of functional issue, and the rest of them are fine. You are lucky you are in the fine group. Don't lift anything over 20 pounds, and we'll see you in 6 months. And he's like, wait a minute. Like, we need some more.
What can she do and not do? So first off, when we went in, the woman, you know, a lot of times it's a joke. Sometimes it's not a joke at all. But there's something people will do where they'll do blink 3 times to show that they're being held somewhere, that someone is not letting them leave. Like it's like a code. So the lady talked to her like that about me. She said, do you like, why are you here? To me, I'm her husband. I'm there because she had a stroke.
Yeah.
And I'm there to support her because she's terrified.
Right.
And she's
For
still in
reasons.
horrible pain and discomfort afterwards.
Horrible.
We don't know what's going on. We don't know if it's going to happen again. We don't know what she can and can't do that could cause it to happen again, because we're being told that there's a chance that it is a vertebral dissection that occurred as a result of trauma, that something in her neck was tight, a vertebrae nicked one of the arteries, and this is why.
Yeah.
That's why I'm there.
Right.
So then we get through that, I mean, which is just, what a way to start a conversation with this person who's supposed to be the best neurologist.
And you're going into the situation not knowing what's happening to you.
Terrified.
Full of fear.
Yeah.
Yes.
And that's not.
So when I asked her, what can she do? Like, what can't she do? She says, what do you want her to do? Like I was trying to get some work out of her or something.
Yeah.
I want her to be able to live her life.
Yeah.
You know, I mean, it was just really bad situation, not good. And we left shortly thereafter. I'd say the whole thing took about 10 minutes.
Yeah.
Yeah. Yep. And it was like, well, you know, just, you need to recover. Just, you know, take it easy.
Mm-hmm.
She's being told that the symptoms that she had are a result of her having had this stroke.
But you had many of those symptoms well before the
big reveal is Thomas Hadley, our dentist, who's a great dentist, recommended you, because he said a lot of what you're feeling, you have bad TMJ, and it may be that.
Could very well be related.
You had these dental surgeries where they removed teeth out of your mouth. They artificially made your mouth smaller. the good news is there's one person here that can help you with it, and you should go. So when Shelly came here, I don't know which part of your process was the initial thing.
Mm-hmm.
She experienced immediate relief.
Yeah.
Of all of the symptoms.
Yeah, I remember
that she was experiencing, which is like, and I mean, of course, we're overjoyed.
Sure.
But as we sit here, this is a podcast and, all that, I have to tell you, a lot of the feeling that I feel, I'm extremely grateful for you that you're doing this because you're treating her as a whole person. You're seeing her the whole thing. It's not segmented. I feel like what you're doing should be the standard of care in a hospital.
Yeah.
So
you guys are
part of the process, but
yeah, and you guys are speaking to. I wish I could tell you I didn't hear these frustrations a lot, but I do, and you're speaking to a point that is a problem. Not to get too overviewed with this, but specialists, especially medical doctor specialists, are really, really, really good at a special thing, and largely they mean well. They're doing the very best they can. They're very, very good at dealing with that thing. But what part of what we're missing with our medicine in the United States and in the first world is everything's kind of siloed, and it's almost too siloed.
Yep.
And we've gone through the process of learning all these connections here. And when you go through that process, you really start to recognize how siloed everything is, and that not enough specialists have an understanding of what the other specialists are doing. So it lives in a weird world, and it is very, very frustrating. I know how frustrating this is because my mother had migraines for 4 decades. Like when Imatrix came out, it was like an injector pen, like an EpiPen, and it was like it was a godsend. Because before that was available, she would 4 or 5 times a year, she would end up in the hospital for 3 days with a headache, and there was nothing they could do about it but just like drug her up and wait for it to pass. My wife dealt with these issues as well. It is incredibly frustrating to try to go to these places with this incredible medical system and all of this incredible knowledge, and they're very, very, very good at what they do, but the connection between the different systems and the different pieces are what are often missing. And then, to speak to your experience, another part of your experience, like people don't have as much grit as you do in searching for answers with this, from what I've seen, because you guys have really, you've become your own advocate, and you've kind of charged through the disappointment and the frustration. And I am so glad that you were a patient at Dr. Hadley's, and that he and I are friends, and that he recognized what was happening and sent you here, because your progress has been amazing. Like you 3 or 4 weeks after we started, you came in, and I was like, this is a different person. Completely different person.
I mean, back in a couple days. That's the thing that's so crazy about it. It's because there's no doubt in my mind what was going on because of that. I mean, it's like, how can something like this be going on?
Yeah.
I mean, we've been dealing with this off and on for a while, and it was absolutely terrifying.
So back
for
in
Shelly, but for me too,
in February, I started really going on this journey to try to figure out how to heal, right? And so I did a lot of different things, and some of them helped, right? Some of it made it so that I was okay to exist. And those were I found the right PT person to massage. I did Reiki, which actually Reiki gave me some relief, which was a very interesting thing, because at that point it was just I was so scared to go to just a massage therapist who didn't really understand things. So just somebody moving the energy. I did Pilates. I tried so many different things. And gosh, I felt some relief. And then in August, I got a new job, and, it's a lot of stress. It's at the computer. It's the strain, and I'm like trying to be perfect, sitting perfectly, doing everything perfect. And I just would have so much pain. And I remember, it was September, and I called you guys, and we got an appointment for October. And I was like, okay, you have to hold on until October. And October 1st is when my benefits kicked in. And I remember thinking, you can't die until October 1st, because that's when your benefits kick in. And that's when your family's going to be okay. Like,
Yeah.
That's how I felt in September. I thought I was going to die.
Yeah.
And then October 29th, y'all put some orthotics in my mouth, and I woke up the next day and I was okay. And it was then Saturday, and I was like, okay, now we're going to do this. 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 And he was like, oh crap, she's back. Like, oh man, we got to go do all this stuff again, because I have so much capacity to be capable. I am like one of the most capable people you can meet. And it stole my life from me.
Yeah.
And you gave it back to me. You did.
I am so sorry that you had to go through that. But I'm really happy. Really happy for you.
And if I came in here and you guys, I explained what was going on, and you said, this is in my wheelhouse. And for somebody to say that, like everything that you're saying, I can take care of. It was overwhelming. And I thought, either it's a miracle or they're the best snake oil salespeople I've ever met. So I was like, well, it's like,
glad we landed on miracle.
God, I was like, okay, it's going to cost X amount of dollars to figure out, is there relief? And that was our first step, right?
Right. Yeah.
And so it was a no-brainer to take that, leap of faith and say, okay, let's try this.
Yeah. It's less profound, but your story, the like such a quick change. And it's also like, it's amazing how like there's all that potential inside of you, and it's like it's covered up with a wet blanket, because it's not just pain, right? It's brain fog. You're at a new job. You're scared to death for your own health in the first place. You also know that because of what's going on, you can't perform like you want to.
That's right.
Right. I had a patient years ago who came in after one of the first couple of visits, and the first thing she said to me when I walked in the room, I was like, hey, how's it going? And she was like, I listened to the radio on the way to work this morning. And I was like, okay, okay. Like, what else is new? And she was like, no, I haven't listened to the radio on the way to work on the way to anything in the morning since I was like 14. And she had that quick of a turnaround as well. And just like you could just, like the face, it's not that your face changed, but like you can just see it in your eyes.
Yeah.
There's an energy there that was buried for too long because of all of the pain, all the discomfort, and importantly, because it's a big part of it, like the fear of what's happening.
Yeah. And what's going to happen.
Yeah.
And remember, like the first time I had to, like when I was talking to you, I had to like physically look. I couldn't do that. I was like, can you move over here, please? Yeah. Because like turning my neck to the side for any amount of time, it was like, this does not work for me.
Yeah. And you're on a swivel now.
Yep, yeah. I can do it. Yeah. And it's so funny because like I'm at work and I'll not be perfect. And I'm like, oh gosh, I feel like, oh my God, I'm allowed to not be perfect.
Yeah. You are allowed to not have to hold yourself in perfect posture all day. You're allowed to not have to wake up in the morning and worry about how bad it's going to be or what things you're not going to be able to do. You're allowed to live your life the way you want. Again. God, I couldn't be happier for you.
Me too.
So if you will, tell us the list off the symptoms that you were dealing with that we discussed in your consult when you came in. Tell us the things that were happening in that moment.
The biggest thing was the pain in the neck, but there was pain in the jaw, a lot of blurred vision, exhaustion, absolute exhaustion, brain fog.
And your sleep quality was
Yeah.
not ideal at that point. Yeah.
I think that's it, but that's probably enough.
Yeah. I think you were, if I remember, there was vertigo and some things happening in your ears as well.
Ringing in the ears.
Yeah.
Yeah, and vertigo.
It's hard enough to sleep in pain. It's harder when you're in pain and there's a bell going off in your ear constantly.
Yeah, which she was told was tinnitus.
Yeah.
Yep. Yeah.
And it
went away.
wasn't tinnitus because it went away.
Yeah.
And at the end of the day, the sounds of the day would kind of drown out some of that ringing. And then when you lay down to go to sleep, and it was like,
it's like somebody turned the volume up on it. Yeah.
Completely.
Yeah. So it was really amazing to. I've done this for a while, but it's also just like amazing for me to see how when we correct these things, then the whole system calms down. And I say correct these things because there are things happening, not a thing happening, right? And when we got your orthotic in, we got the joint decompressed, and in doing so, inflammation starts to come out of that area. The joint being close to the ear, the inflammation in the ear starts to calm down, so the ear symptoms get better. And one thing that people don't realize a lot is that your neck muscles have a lot to do with what your jaw's doing, in that every movement we do, there are active muscles and there are stabilizing muscles. And if we're making a movement with our jaw, then that's an active muscle group, and the stabilizing muscles for anything we do with it are the muscles in your neck and in your upper back. So there's a lot of people who have neck and upper back pain that's chronic. It's kind of always there. It ebbs and flows. It'll get better or get worse, but it's always kind of there. And it has it doesn't have anything to do with what's happening in their spine. It has everything to do with what's going on from a habitual standpoint with the muscles of the face, what's going on with the joint, because problems in the joint can cause the muscles in your jaw and in your face to tense up. So when we got those things corrected, and it really just brought the system back into balance, you got much better very quickly.
And then also all of the myofunctional
therapy.
Yes.
Physical therapy for your face.
I had no clue that was even a thing.
Yeah.
And going through it, it's been like 4 or 5 months of it now. I can really tell a difference. Like my ability of my tongue and my jaw is much stronger.
Yeah. And you've got people usually tell me they have more awareness of what they're doing with it.
I say I live in my mouth.
Yeah. Like my head is in my mouth all the time. And frankly, right now, that's a good thing, right? Because we're seeing the benefits from it.
And I had no clue that I did not have enough space in my mouth for my tongue. And then once that the awareness is there.
Yeah. And then you gain some idea, okay, this is where my tongue needs to live. Because so much of this is habit that we form as a compensation for what's happening in the joint, or we form habit as a compensation for what's happening with our airway a lot of the time. And awareness, then an understanding of what you need to do with it, can completely change that experience for you. Yeah.
Yeah. Every day I walk the dog at 5 a.m. in the morning and do all of my exercises.
Yeah. Your dog looks look at you like you're even crazier than you were
doing?
Before. That's great. So I want to talk a little bit about your journey with this so far since you've been working with us. Obviously, you had your treatment plan, but treatment plans are very, very different. And yours was one that was phased. The first phase, let's do everything we can. Let's address all of these things that are happening, and let's get you feeling as good as we can, as quickly as we can. And now you're at the point in this where you're transitioning to the second phase, which is, okay, we'll take all of this and make this permanent. And we've already talked about it. So you guys know that there's a lot to consider in this decision. And there's a lot to think about. So if you can just tell me your thoughts on how you got to a phase 2 decision and the factors that were involved.
Yeah.
Just give us some insight on that.
Well, we talked a lot about it as we were going through phase 1.
Mm-hmm.
And just the fact that I felt so good. And it was like, okay, I got my life back and I want to keep my life.
Yes.
Like I want to feel like this because I've got a long runway ahead of me.
Right.
So, talked about like, what's the priority? The priority is to have a solution that has that long runway,
right?
Like the solution.
Yeah.
And do it once and then don't have to think about it.
Yeah.
So, we talked about, there's a couple different things and some of them had pros and cons, but the one solution that had all of those things was that we're going to do opening up of the mouth, making that room for
mm-hmm.
the tongue. That when I was like 11 years old, I had the 4 teeth extracted and the mouth was, mouth was narrowed. And that's a lot of where all of these problems begun. So kind of remediating that
mm-hmm.
and getting my mouth structure to where it is appropriate for, this big mouth of mine. And so getting that room and, we talked about braces, we talked about trays,
mm-hmm.
and I will be getting braces, which is just hilarious to us, and so then we talked about with braces, there could be a potential of pulling up, to get the teeth to the appropriate bite.
Yeah, there's risk involved in
mm-hmm.
going through the whole process in braces for some people. For
yep.
Sure.
And I appreciated how we talked about all of those. And, we talked about root to tooth ratio. And we got into it.
Yeah.
We really did. And I appreciated all that information because it really helped me make the right decision for me.
Mm-hmm.
So we are going to be doing the porcelain to build everything up. And what I loved about it is like every single tooth is going to be optimized for the next 50 years of my life.
Yeah.
So I feel like, I'm being reborn kind of, it's like I've got this opportunity. So, we talked about it and, we saw like this, I am taking the premium solution, right? Because
Sure.
I'm taking the solution we're going to do it one time. And the cost was a lot. And the fact that you were just like,
oh, yeah, it's an absolute no-brainer to me as far as all that was concerned.
yeah, because it was like the quality of my life versus this one-time cost. It was like, we are very, very fortunate. The insurance does not cover any of this. And that's another podcast that you could probably have.
That's a whole series of podcasts.
Yes.
There are already podcasts on that.
Yes. And we are very fortunate that we are in the position to, be able to accommodate that.
Mm-hmm.
After having had that experience, if we had to take out a mortgage on our house, I would have said yes as quick.
The quality of life improvement
Yes,
is that profound.
Yes.
Yeah.
Yes.
Yeah.
And just not having to live in fear.
Mm-hmm.
Because I was terrified.
Sure.
I 100% want to die first. I mean, that's my, 100%.
Yeah.
I mean, I'm joking.
Are you okay with that?
Yeah, we know that's going to happen.
Yeah, we talked about it.
She does better on her own, but yeah, seriously. I mean, it was a no-brainer.
So it's you guys did this the best. You made this decision the best way possible by considering all of the important things. And there's not a list of important things that should be important to everybody. There's a list of important things that are important to you, right? To each person who goes through this process. And sometimes it's time, And sometimes it's longevity, and sometimes it's how long is this treatment going to be, and sometimes it's how much money is this going to be, and sometimes it's all of this stuff. But going through the process of breaking those things down, giving some weight to the things that are important, and really, really incredibly importantly, your support of her through this is not something we see all the time, and it is wildly important for success. Like
Yes.
incredibly important for success. Yeah, I'm just,
It's my honor. I mean, it's my honor. It's my responsibility. So,
well, it's exceptional.
Thank
And I knew it the first time we met, the first time we met in the consult room. I was like, this guy's
thanks.
in it. So,
Thank you. Well, you're exceptional too, man.
well, thank you.
And I tell people this story, and I'm like, and he lives a mile away from where we live. It's a mile away. Like, we are so.
Yeah, that's right. We're in the same neighborhood.
Yes,
aren't we?
we're so fortunate that you're here and this practice is here, and you guys are doing this because you guys have patients that come from out of state.
We do. Yeah.
Because this is something special.
Yeah. It's feels good when people come in from out of state. It also doesn't feel good because there should be enough people doing this where you don't have to travel hundreds of miles to find it. And there are a lot of other providers in the U.S. who do things the way we do, but they're as difficult to find for the average patient as we are sometimes. So, but I'll take the serendipity of all of this working out whenever I can get it. Well, Michelle, thank you very much. Thank both of you for coming in and taking the time to share your experience, share your story. We do this because we want this information to get out there. Obviously, it's not out there enough, or you wouldn't have had so much trouble finding a solution. So thank you for doing this for the other people out there who are looking for a solution, right? And everybody in the office, like we meet about this once a week, and we make it a point to celebrate the wins, and we celebrate your win every week when we meet, and we couldn't be happier for you.
Thank you.
Thank you very much.
Thank you.
All right. That is the end of this podcast number 2. And we will be back with more information, more patient stories, more insight, and hopefully more help for the people who need it. Thank you.